Hi! 2 years ago, I decided to start making videos of reading aloud the American Council on Exercise curriculum for studying for the personal trainer exam. I've been procrastinating for 2 years, and my exam is coming up very soon. Based on other YouTube videos that I've used to help me prepare, I found that this book, as opposed to the Essentials for Exercise Science book, is actually the book to be focusing on if you are going to be reading any of the books thoroughly. So I will focus on Chapter 7 in this video, hopefully get it read through all the way, and continue to upload read aloud chapters from this book so that I can listen to the audio, and perhaps you can too. Chapter 7, Functional Assessments, Posture, Movement, Core, Balance, and Flexibility. In this chapter, you will learn about static postural assessments, movement screens, flexibility and muscle length testing, balance and the core, and then we'll go through the summary. Sequencing a client's assessments involves consideration of both protocol selection and timing of the assessments. While trainers must always conduct the health risk appraisal or assessment discussed in Chapter 6, the physiological assessment selected must be consistent with the client's goals and desires and with the discoveries made during the needs assessment conducted during the initial interview. While clients often express a desire to lose weight, tone, or shape their bodies, or improve their overall fitness levels, one primary objection of all training programs should be to improve functionality, which means that they should help clients enhance their ability to perform their activities of daily living, or ADL. One key facet of functionality involves movement efficiency, or the ability of an individual to generate appropriate levels of force and movement at desired joints, while controlling or stabilizing the entire kinetic chain against reactive forces and gravity-based forces. While movement is integral to human survival, it operates from a static base or alignment of the body segments, which is commonly referred to as posture. Since movement originates from this base, a postural assessment can be conducted to evaluate body segment alignment in addition to movement screens that evaluate how posture, both good and bad, impacts the ability to move. Static postural assessment. Static posture represents the alignment of the body's segments, or how the person holds him or herself statically or isometrically in space. Figure 7-1. Holding a proper postural position involves the actions of multiple postural muscles that are generally the deeper muscles that contain greater Holding a proper postural position involves the actions of multiple postural muscles, which are generally the deeper muscles that contain greater concentrations of type 1 muscle fibers, and function to hold static positions or low-grade isometric contractions for extended periods. Good posture or structural integrity is defined as that state of musculoskeletal alignment and balance that allows muscles, joints, and nerves to function efficiently. Kendall et al. 2005. However, if a client exhibits deviations in his or her static position from good posture, this may reflect muscle endurance issues in the postural muscles and or potential imbalance at the joints. Movement begins from a position of static posture. Therefore, the presence of poor posture is a good indicator that movement may be dysfunctional. Although movement screens offer valuable information related to neuromuscular efficiency, a static postural assessment is considered very useful and serves as a starting point from which a personal trainer can identify muscle imbalances and potential movement compensations associated with poor posture. A static posture assessment may offer valuable insight into muscle imbalance at a joint and the working relationships of muscles around a joint. Muscle imbalance often contributes to dysfunctional movement. Altered neural actions of the muscles moving and controlling the joint. For example, tight or shortened muscles are often overactive and dominate movement at the joint, potentially disrupting healthy joint mechanics. The concept of neural hypertonicity is covered in Chapter 9. Carefully read through the information presented in tables 7-1 through 7-3. Because the postures depicted are common deviations, you are likely to observe clients with one or more of these variants. Think about methods you would employ as a personal trainer to help clients with these muscle imbalances. Can you come up with at least one stretch for each tight muscle group and one strengthening exercise for each inhibited muscle group? I'm going to briefly read through Table 7 Tac 1 to Table 7 Tac 3, although you will want to look at these in your book. 7-1. Muscle imbalances associated with kyphosis, lordosis, posture. Facilitated or hypertonic or shortened muscles. The facilitated or hypertonic or shortened muscles or tight muscles, as we often refer to them, that you will see in imbalances associated with kyphosis and lordosis are tight hip flexors, tight lumbar extensors, tight anterior chest and shoulders, tight latissimus dorsi, and tight neck extensors. The inhibited or lengthened muscles you will see in this posture imbalance are lengthened hip extensors, lengthened external obliques, lengthened upper back extensors, lengthened scapular stabilizers, and lengthened neck flexors. Table 7-2. Muscle imbalances associated with flat back posture. The facilitated hypertonic or shortened muscles in flat back posture are rectus abdominis, upper back extensors, neck extensors, ankle plantar flexors. The inhibited or lengthened muscles associated with flat back posture are iliacus or psoas major, internal obliques, lumbar extensors, and neck flexors. Table 7 Tac 3. Muscle imbalances associated with a swayback posture. Facilitated, hypertonic, or shortened muscles will be hamstrings, upper fibers of posterior obliques, lumbar extensors, and neck extensors. The inhibited or lengthened muscles associated with swayback posture are iliacus and psoas major, rectus femoris, external obliques, upper back extensors, and neck flexors. Figure 7-2 and 7-1 describe general posture setups, the way that the bones are positioned, the way that they would look. They describe that from neutral to scoliosis. So I'm just going to read each figure explanation. So figure 7-1 is a neutral spine. Neutral spine alignment will have a slight anterior or lodoctic curves at the neck and low back and a posterior kyphotic curve in the thoracic region. In 7-2 alpha, lordosis will have an increased anterior lumbar curve from neutral. Kyphosis will have an increased posterior thoracic curve from neutral. Flat back will have a decreased anterior lumbar curve. Swayback will have a decreased anterior lumbar curve and an increased posterior thoracic curve from neutral. Scoliosis is a lateral spinal curvature often accompanied by vertebral rotation. Key concepts. Muscle imbalance and postural deviations can be attributed to many factors that are both correctable and non-correctable, including the following. Correctable factors are repetitive movements, muscular pattern overload, awkward positions and movements, habitually poor posture, side dominance, lack of joint stability, lack of joint mobility, imbalanced strength training programs. The non-correctable factors are congenital conditions such as scoliosis, some pathologies, rheumatoid arthritis, structural deviations, tibial or femoral torsion or femoral anteversion, and certain types of trauma, surgery, injury, or amputation. Proper postural alignment promotes optimal neural activity of the muscles controlling and moving the joint. When joints are correctly aligned, the length-tension relationships and force-coupling relationships function efficiently. This facilitates proper joint mechanics, allowing the body to generate and accept forces throughout the kinetic chain, and promotes joint stability and mobility and movement efficiency. Refer to Chapter 9 for more information on the concept of mobility, stability, and movement efficiency. Figure 7-3 illustrates the importance of muscle balance and its contribution to movement efficiency. Given how an individual's static posture reflects potential muscle imbalance, it stands to reason that trainers should consider conducting a static postural assessment on their clients as an initial assessment. Figure 7-3 lays out movement efficiency pattern. It starts with muscle balance. Muscle balance can lead to normal force coupling relations and normal length tension relationships. Normal length tension relationships and normal force coupling relationships turn into proper joint mechanics, orthokinematics. Proper joint mechanics turns into efficient force acceptance and generation, which promotes joint mobility and stability, which ends up in movement efficiency. Given the propensity many individuals have toward poor posture, an initial focus of trainers should be to restore stability and mobility within the body and attempt to straighten the body before strengthening it. The trainer can therefore start by looking at a client's static posture, following the right angle rule of the body. This model demonstrates how the human body represents itself in vertical alignment across major joints, the ankle and subtalar joint, knee, hip, and shoulder, as well as the head. This model allows the observer to look at the individual in all three planes to note specific static asymmetries at the joints, front to back and left to right. As illustrated in Figure 7-4, the right angle model implies a state in the frontal plane wherein the two hemispheres are equally divided, and in the sagittal plane wherein the anterior and posterior surfaces appear in balance. The body is in good postural position when the body parts are symmetrically balanced around the body's line of gravity, which is the intersection of the mid-frontal and mid-sagittal planes, and is represented by a plumb line hanging from a fixed point overhead. While this model helps trainers identify postural compensations and potential muscle imbalances, it is important to recognize that limitations exist in using this model. Plumb-Line Instructions. Using a length of string and an inexpensive weight such as a washer, trainers can create a plumb line that suspends from a ceiling or fixed point to a height of 0.5 to 1 inch or 1.3 to 2.5 centimeters above the floor. It is important to select a location that offers a solid, plain backdrop or a grid pattern with vertical and horizontal lines that offer contrast against the client. When conducting these assessments, the trainer should instruct the client to wear form-fitting athletic-style clothing to expose as many joints and bony landmarks as possible, and have the client remove his or her shoes and socks. The use of adhesive dots placed upon the bony landmarks may assist trainers in identifying postural deviations. The objective of this assessment is to observe the client's symmetry against the plumb line and the right angles that the weight-bearing joints make relative to the line of gravity. Individuals will consciously or subconsciously attempt to correct posture when they are aware they are being observed. Personal trainers should encourage clients to assume a normal, relaxed posture and utilize distractions such as a casual conversation to encourage this relaxed posture. It is important to remember that while postural assessments provide valuable information, they are only one piece to the movement and efficiency puzzle, and this should not be overemphasized. Personal trainers should focus on the obvious gross imbalances and avoid getting caught up in minor postural asymmetries. Trainers should bear in mind that the body is rarely perfectly symmetrical and that overanalyzing asymmetries is time-consuming, potentially intimidating to clients, and may induce muscle fatigue in the client that can alter his or her posture even further. Therefore, when looking for gross deviations, the trainer should select an acceptable margin of asymmetry that he or she will allow and focus on larger, more obvious discrepancies. For example, start by focusing on gross deviations that differ by 1/4 of an inch or 0.6 centimeters or more between the compartments of the body. Plumb line positions, frontal views, anterior and posterior. For the anterior view, position the client between the plumb line and a wall, facing the plumb line with feet equidistant from the suspended line, using the inside of the heels or the medial malleoli as a reference. With good posture, the plumb line will pass equidistant between the feet and ankles and intersect the pubis, umbilicus, sternum, mandible or chin, and maxilla, face, and frontal bone, forehead. For the posterior view, position the individual between the plumb line and a wall facing away from the plumb line with the insides of the heels equidistant from the suspended line. With good posture, the plumb line should ideally bisect the sacrum and overlap the spinous processes of the spine. Sagittal view. Position the individual between the plumb line and the wall, facing sideways with the plumb line aligned immediately anterior to the lateral malleolus or ankle bone. With good posture, the plumb line should ideally pass through the anterior third of the knee and the greater trochanter of the femur and the acromyoclavicular joint, and slightly anterior to the mastoid process of the temporal bone of the skull, in line or just behind the earlobe. Transverse view. All transverse views of the limbs and torso are performed from frontal and sagittal plane positions. Trainers must respect scope of practice when performing a postural assessment on the client, particularly in the presence of pain or injury. They must understand the need for referral to more qualified healthcare professionals when pain or underlying pathologies are present, such as scoliosis. When conducting assessments of posture and movement, the following key components should be included. They are client history, written and verbal, collect information on musculoskeletal issues, congenital issues like scoliosis, traumas, injuries, pain and discomfort, the site of pain or discomfort, and what aggravates and relieves pain or discomfort. With discomfort in the upper back, the client may feel temporary relief by hunching forward and rounding the shoulders. Collect lifestyle information, include occupation, side dominance, and habitual patterns. Like information regarding these patterns may take time to gather. I read that wrong. Visual and manual observation. Identify observable postural deviations, verify muscle imbalance as determined by muscle length testing, determine the impact on movement, ability, or efficiency by performing movement screens, and facilitate movement to distinguish correctable from non-correctable compensations. And then there's a table that has different phases laid out. So, because it talks about the phases, I'm going to read it real quick. You take a health history and lifestyle information, and you do a static postural analysis. There's a dotted line shooting off saying that documentation and determination of need for a referral to medical professional, that comes right before your static postural analysis, so right after you take your health history and lifestyle information, because you may not be able to move forward with the client if there's something outstanding in their health history that is outside of your scope of practice. Okay, so after you take your postural analysis, you're going to possibly do muscle length testing, active and passive range of motion if needed. For sure, you will then identify any correctable postural compensations, and you're going to administer the appropriate movement screens. After that, you're going to go into phase 1, which is your stability and mobility training. So it's restorative exercise. Then you're going to go into phase 2, which is movement training or movement patterns. And then phases 3 and 4 is progression load and performance training. While postural assessments can be performed in great detail, the following sections address 5 key postural deviations that occur frequently in individuals. I'm going to stop here, upload this video, and then go ahead and do the next video talking about the deviations.